Hi there, my name is Dr. Angus Robinson. I'm a consultant clinical oncologist and we may well have met in the clinic. This video is to summarise the radiotherapy treatment that we have recommended for you, how it's planned, how it is delivered and the potential side effects of treatment. I hope that this is useful and saves you and I time in the clinic, giving you as much information as possible. So radiotherapy is X-ray treatment, which is given usually as treatment from outside the body on a daily basis for somewhere between 4 and 8 weeks. The total number of treatments and the duration depends on the volume that we have to treat. In most cases, treating prostate cancer, it is done in 4 weeks or 20 doses, given Monday to Friday on a daily basis. If we are treating the prostate and the pelvic lymph nodes, this is a larger volume and we would have to give a smaller dose per day, but over a longer period of time, and hence this is normally given over 7.5 weeks. To plan and target radiotherapy, we need to do a CT scan of the pelvis. This is done in the cancer centre. Just before the scan is done, we need patients to use a small enema to clear the bowels out and to drink a few glasses of water to fill up the bladder slightly. Both of these procedures are done to ensure that the anatomy in the pelvis is in a reproducible position whereby the movement to the prostate is as small as possible on a daily basis. During the scan, the planning scan, a small metal mark is put on the skin, on the tummy wall and on the flanks, and as this mark is then taken off, a small tattoo is put in its place. This is a small blue dot which is permanent. This will then give us an external reference point to internal structures and help the radiographers set you up in the right position every day that you come for treatment. The planning scan takes about 20 minutes to half an hour, and then the scan images from the planning scan go on to some software on a computer screen, and behind the scenes I or the other consultant oncologists will come along and draw the area that we feel needs treatment. This would be the prostate, the region around the prostate, and possibly the pelvic nodes as mentioned before. We also draw on this scan the normal structures nearby, such as the bladder, the back passage or rectum, and the hips. And then we give all of this information plus the dose that we're planning to give to the physics team, and they come up with a treatment plan that's tailor-made for you and your anatomy. This planning procedure takes a little bit of time, and between the planning scan being done and starting treatment, there's usually a gap of around 3 weeks. Sometimes when the planning scan is done and we start doing the voluming and the physics planning, we do discover some challenges, such as the rectum is too large or the bladder is too small, or there is going to be some difficulties delivering the right dose of radiotherapy to the prostate without causing too much dose to the normal structures nearby. Occasionally, therefore, we will ask people to have a repeat scan, possibly with some slightly different bladder or bowel preparation. When the radiotherapy starts, and it's most commonly given in the tomotherapy unit in Preston Park or in the Eastbourne radiotherapy unit, it is daily treatment Monday to Friday for the duration of doses that we've mentioned previously, either 4 weeks or nearly 8 weeks. The same procedure applies with respect to bladder and bowel preparation. So we ask that people use a small enema every day and about an hour before their treatment is due, and then drink a few glasses of water to fill the bladder up. So most people go to the department about an hour earlier than their scheduled appointment, use the enema, go to the toilet, empty the bowels, and then drink the water prior to their turn. Your treatment slot is about 15 minutes long when you are in the room with the radiographers. Most of that 15 minutes is in fact spent getting you in the right position for treatment, so lying you on the couch, making sure the laser lines line up with the tattoos, and then doing a quick check CT scan that we do on a daily basis before we give you the treatment to make sure that all the internal structures are in the same position that they were when we did the planning scan. The treatment machine is only on delivering the radiation for about 2 to 3 minutes. The treatment is painless, you don't feel anything. It's just like having a CT scan done, and on a daily basis you'll probably notice no side effects at all. And it's only after about 2 or 3 weeks that some side effects start to kick in. Some people escape the side effects completely, but if you do get side effects, it's due to the fact that the bladder and the bowels become slightly inflamed and irritated. The symptoms, therefore, are that when you have an inflamed bladder, passing urine is uncomfortable, so you get stinging and burning, and people can go to the toilet a bit more frequently, so you might go during the night a bit more frequently, and daytime frequency increases also. The same thing applies to bowel symptoms, so the inflammation in the lining of the bowel can result in some discomfort on passing motions, sometimes some mucus discharge, and sometimes some diarrhea. There's also a degree of fatigue related to the treatment. Daily trips to the hospital are quite tiring anyway, but in addition there is radiotherapy related fatigue which can affect you. The side effects, if they do come on after 2 or 3 weeks. They peak at the end of treatment, and then they take about 4 to 8 weeks to settle down once the treatment has finished, as the body heals. You are routinely reviewed in the follow-up clinic about 6 to 8 weeks after radiotherapy has completed, and that is usually to look at how the side effects are improving, and often to check an up-to-date PSA level as well. There are some long-term side effects which may be permanent as a result of the radiotherapy. If a sexual function has been normal prior to the treatment, then there can be some long-term effects of the radiotherapy. The hormonal treatment that many people received with prostate cancer radiotherapy also impacts on sexual function, but the radiotherapy itself can cause some permanent changes in the nerves and blood vessels around the prostate, which are adjacent to the base of the penis, and therefore difficulties with erections is a long-term complication. In addition, what the prostate does when it's healthy is it's involved in producing the fluids involved in ejaculation, and if you give high doses of radiotherapy to the prostate, this can therefore be affected, and the ejaculation can dry up, or it can change colour, and the sensation associated with ejaculation can change. There are some long-term effects on the bladder and bowel as well. They are usually mild and usually a slight change in the frequency with which people go. So if you are someone who goes to the toilet to open your bowels once a day at the moment, in the future it might be 2 or 3 times a day. Also, the message to go speeds up, so something which we call urgency. Incontinence is extremely uncommon. Bladder symptoms are that the bladder capacity becomes a little bit less than it would be prior to the radiotherapy. The radiotherapy causes scarring in the lining of the bladder, which makes the bladder walls stiffer and not as stretchy, and therefore the desire to go to the toilet after having had a drink or 2 is more frequent. There's also the risk long term that we cause some damage to the superficial blood vessels in either the lining of the bladder or in the bowel, and this can cause bleeding long term. The blood vessels can spontaneously pop and bleed, causing blood in the urine or blood in the stool. Now, this is always an alarming symptom to see and always needs investigating to make sure that it isn't another cause of the bleeding, but often the urologists will have a look up in the bladder, or the bowel doctors will look into the back passage and see what they would refer to as radiation damaged blood vessels, or telangiectasia, and this then is deemed not serious but does need just monitoring. There is also a potential long-term effect of radiation at causing a second malignancy. Now, this is a rare complication and is usually 15 or 20 years after the treatment has been given, and you will have this conversation with your oncologist about the pros and cons of the radiotherapy treatment. Usually the benefits of the radiotherapy at eradicating the cancer that you have far outweigh the risks of a second cancer developing in the future. I hope this has been a useful summary of the delivery of the radiotherapy and how it's given, and you will have a chance to chat with the radiographers, the people who give the radiotherapy, when you start the treatment.